So good afternoon, everyone. Welcome to today's Personal Responsibility Education Innovative Strategy Program, New Grantee Orientation. My name is Patrick Ahern with RTI, and I'll be helping out with the virtual room today. Please note when you log in that your microphone is automatically muted. But if you have any questions for our presenters today, feel free to type those into the Q&A window. And if you run into any technical issues with the Zoom, please reach out to me in the chat window and I can help with troubleshooting. So at this time, we're going to begin with an introduction from Debbie Powell.
Hello, I'm Debbie Powell, and I serve as the Deputy Associate Commissioner and the Acting Associate Commissioner for the Family and Youth Services Bureau, or FYSB. We lie at the Administration for Children and Families, and I provide senior leadership for 3 FYSB grant programs, one of which is the Adolescent Pregnancy Prevention Programs, also known as the APP program. On behalf of FYSB, and specifically the Division of Optimal Adolescent Development, where the APP programs are administered, we welcome you and are excited that you have joined us virtually for orientation for the new FY21 grantees. We are appreciative of your commitment to implement effective personal responsibility education programs and sexual risk avoidance education prevention services throughout the United States and U.S. territories. We acknowledge the challenges of delivering services during a pandemic. However, we are very happy and proud that grantees have continued to reach hundreds of young people given this monumental barrier. Many of you have proven to be tremendous leaders and advocates who have advanced FYSB's understanding and programming in the field. We are very proud to call you partners. I'd like to thank all of you for your hard work and your diligence in responding our APP Notice of Funding Opportunity announcement in July and commend you on submitting such thorough and well-developed applications. And it goes without saying, congratulations, not only on your successful applications, but in your commitment to foster the growth and success of at-risk youth in your communities. I'm very pleased to say that FYSB awarded a total of $52 million in SRAE and PrEP grants to 89 organizations that work every day to prevent adolescent pregnancy, and for some, to prevent sexually transmitted infections, including HIV and AIDS. We can't wait to see and help foster your success in providing effective adolescent pregnancy prevention programming to help prepare youth for a brighter future. Of course, you're already familiar with the APP program as evidenced by those applications, but today's orientation provides the opportunity to look closely at the inner workings of the legislation, the processes and practices for properly managing your grant and the resources available to help you do so. There will be a lot of information thrown at you provided today, and it's essential for you to understand how and where it factors into your work. So get comfortable, be engaged, and ready for our question and answer period at the end of the presentation. Let me share a little bit of what will be presented to you during this orientation. We will introduce you to our awesome FYSB staff. We will provide an overview of FYSB and the APP programs and requirements. We will review the guiding legislation for your work. Introduce you to training and technical assistance resources and partners. Present an overview of the role of the Grants Office and resources that are available to grantees. Plus, We will show you some of the readily available tools and resources at your disposal, like the Exchange, which is an awesome interactive activation platform for APP grantees, partners, and stakeholders to help increase the visibility and impact of your efforts to prevent pregnancy among our most vulnerable youth. And last but certainly not least, the We Think Twice campaign, designed to promote healthy relationships, goal setting, and empowerment among youth. You'll also learn about the support that our team provides for building data capacity and local evaluations. We highly encourage you to conduct continuous quality improvement and local evaluations that will further our understanding of the anticipated outcomes and impact of your projects, and to demonstrate our projects effective. Once again, I am very happy to welcome you to the APP program. And remember, FYSB is always here to provide you the assistance, the guidance, the resources, and support you need to be successful in all aspects of your programs. Once again, congratulations, good luck, and thank you for your continued commitment to our youth.
Hello, everyone. Congratulations again to receiving a PREIS Cooperative Agreement Award. I'm Jessica Johnson, a Federal Project Officer and the PREIS Administrative Lead. Today's orientation is divided into 9 parts and a question and answer session at the end. Following introductions, I'll provide an overview of the Family and Youth Services Bureau, also known as FYSB, and the Adolescent Pregnancy Prevention Program, which we refer to as APP. We will then review the purpose and requirements of PREIS and the roles and responsibilities of the program office. I will then hand it over to Ms. Bridget Shea Westfall from the Office of Grants Management to share the roles and the responsibilities of the Grants Management Office and provide critical information related to grants management, policy, and reporting. Last but not least, we'll hear from our contractors and partners on PrEP performance measures, local evaluation support, and training and technical assistance. Labrita White, an APP program manager, will provide closing remarks. We will have an opportunity for questions and answers at the end of the webinar. As stated earlier, you're welcome to enter your questions into the chat during the presentation. Next slide. One more click. There we go. Okay. First, I'd like to introduce FYSB and the APP team. Pictured here is the FYSB APP leadership team. Debbie Powell, who you just heard from, is the Acting Associate Commissioner of FYSB. Courtney Gaskins is the Director of the Division of Optimal Adolescent Development, which the APP program falls under, and Labrita White is a Program Manager. Next slide. Okay, I think we're finally getting there. All of our pictures are uploaded. Pictured here are the administrative support staff and federal project officers within the Adolescent Pregnancy Prevention Program. The APP program specialists include Vernay Martin, Patrice Moss, Tanya Matthews, Letitia Winston, myself, Jessica Johnson, Christine Zakor, Kathleen Derrick, Ricky Richard, Latonia Coriat, Megan Hill, and Alexandria Washington. Our program is also supported by Tarshika Thompson, our executive assistant, and Owen Burns, our communications manager. Next slide. This slide provides an overview of the organizational structure of FYSB. The Family and Youth Services Bureau is located within the U.S. Department of Health and Human Services, Administration on Children, Youth, and Families. There are 4 divisions within FYSB. The Adolescent Pregnancy Prevention Program falls within the Division of Optimal Adolescent Development. Next slide. The PrEP program is designed to educate adolescents on abstinence and contraception to prevent pregnancy and STIs, including HIV/AIDS. Projects must incorporate at least 3 of 6 adulthood preparation subjects, which include healthy relationships, adolescent development, financial literacy, parent-child communication, educational career success, and healthy life skills. There are 4 PrEP funding streams, which include state PrEP, competitive PrEP, tribal PrEP, and last but not least, PREIS. Next slide. The APP program administers 275 grants through 7 funding streams throughout the nation and several U.S. territories. Several new grants were awarded in fiscal year 2021, including 12 new PREIS grants for over $10 million. Next slide. The purpose and requirements for PREIS are outlined in your Notice of Funding Opportunity announcement. Today, I'd like to highlight just a few critical components. Next slide. The legislation for PREIS specifies that the program is administered by the Department of Health and Human Services. The services must award grants to organizations to implement innovative youth pregnancy prevention strategies. They must target services to high-risk, vulnerable, and culturally underrepresented youth populations, and agree to participate in a rigorous federal evaluation of the activities with grant funds. Next slide. The goal of the PREIS program is to implement innovative youth pregnancy prevention strategies and target services to high-risk, vulnerable, and culturally underrepresented youth. The objectives are to implement the interventions with the target populations to prevent pregnancy and STIs, including HIV/AIDS, rigorously evaluate the interventions using either a quasi-experimental design or randomized controlled trial, manualize and package the intervention, and disseminate lessons learned, best practices, and relevant findings. Next slide. The legislation specifies the age range of PREIS as well as the target populations. PREIS targets youth ages 10 to 19, except in the case of pregnant and parenting youth, which may include youth under 21 years old. PREIS programs serve culturally underrepresented populations, youth in foster care, runaway and homeless youth, pregnant women and mothers under the age of 21 and their partners, and youth residing in areas with high teen birth rates. Next slide. PREIS specifically requires programs to implement innovative strategies. All of the other program requirements listed here are standard for all of APP's PrEP programs. All PrEP programs are required to emphasize abstinence and contraception, cover adulthood preparation subjects, provide medically accurate information, ensure that materials are age appropriate and culturally appropriate, adhere to principles of trauma-informed care, and provide referrals to other services as needs are identified. Next, I'll provide a more detailed information on all of these program requirements. Next slide. PREIS program strategies must be innovative. Innovations are defined as new products, programs, ideas, or practices that are tailored to the target population for a specific outcome. Proposed interventions must have relevant process evaluation findings and promising evidence of effectiveness or impact, but must not have been previously rigorously evaluated. Applicants are expected to propose interventions that are fully developed and should have prior experiences in implementing the program. Next slide. PrEP programs must include activities to educate youth on both abstinence and contraception. PrEP programs must place substantial emphasis on both for the prevention of pregnancy and STIs, including HIV/AIDS among youth. Next slide. All PrEP programs, including PREIS, are required to address at least 3 out of these 6 adulthood preparation subjects. We also refer to adulthood preparation subjects as APS. These APS subjects are part of the PrEP legislation. They include healthy relationships, adolescent development, financial literacy, parent-child communication, educational and career success, and healthy life skills. Next slide. The medical accuracy review will be a critical activity for phase 1 of your project. Next slide. Here is the definition of medical accurate and complete as stated in the PrEP legislation and your notice of funding opportunity announcement. What is key is to ensure that the information provided to you is both verified and supported by scientific research. Next slide. Medical accuracy reviews are important for 2 reasons. Medical information is constantly evolving, and as new discoveries are made, program materials can become outdated. The obvious is to ensure that program materials are accurate, complete, and up to date when shared with youth. Grantees are encouraged to independently review materials on a regular basis and make updates as needed. Next slide. Issues that are addressed in the review are typically related to information that is inaccurate, incomplete, outdated, poorly referenced or supported by non-scientific studies, confusing or misleading, or contradictory to the program requirements. Next slide. This slide outlines what will be requested of grantees to help ensure medically accurate program materials. Grantees should conduct an initial review of their program materials for medical accuracy prior to submitting to FYSB and our contractors. Our contractors include Gray Matters and PALTech. If using program materials that can be modified, issues should ideally be corrected prior to submission. Additionally, grantees are encouraged to independently review the materials on a regular basis and make updates as needed. Based on past experience, we have noted that during the review process that some grantees opt to select modifications to their curricula to make sure that it fully conforms to the program requirements and include medically accurate information. The second step is for grantees to submit the materials to FYSB, Gray Matters, and PALTech for review. The third step is to respond to and address inaccuracies found by the review using various methods. The methods you might use to address these inaccuracies include making modifications to the actual curriculum text, creating an insert with updated information, selecting a different or supplemental brochure, video, handout, or another resource, or consulting with the developer on any significant changes to the curricula. Next slide. During phase one, the first 9 months of the program, all PREIS grantees will be required to submit all program materials to the medical accuracy review. Programs will be expected to obtain approval and finalize all program materials prior to use and prior to beginning the implementation period, which is phase two. Next slide. All program materials must be age appropriate, which means that the topics, messages, and teaching methods must be suitable to everyone, and also suitable to the cognitive, emotional, and behavioral capacity for that age group. Materials must also be culturally appropriate, incorporating the norms, beliefs, and values of the target population, and demonstrating cultural sensitivity and competence by providing social, linguistic, and culturally sensitive programming. Next slide. PREIS programs should take into account the trauma and mental health needs of youth who have experienced maltreatment, abuse, or exposure to a violence. All programs should create and maintain a safe space for youth, welcoming to all youth, inclusive, and non-stigmatizing. Next slide. Programs must provide referrals to other healthcare services as needs are identified. Programs can use PREIS funds to screen and refer youth to services. However, the health services themselves cannot be paid for with PREIS funds. Programs are encouraged to develop partnerships to help with facilitation of the referrals, and when feasible, confirm the initiation of service delivery. Next slide. As outlined in your notice of funding opportunity announcement, there are 3 phases to the PREIS project. Phase 1 is the first 12 to 18 months of your project. This is perhaps the most critical phase of your project to ensure that it is successful. Phase 2 happens during years 2 through 4 of the project, and phase 3 is in year 5. In order to transition to the next phase, you have to complete all of the activities in the previous phase. Next slide. The first phase of PREIS focuses on planning and piloting. Activities include filling vacancies and training staff on how to deliver the intervention, finalizing MOUs with partners or contracts, developing instruments and conducting cognitive testing on these instruments, conducting a pilot on 1 full cycle of the intervention, completing the medical accuracy review, and refining or revising the curriculum and training materials. In this first phase, you'll also be working with our evaluation TA providers to develop and receive approval on an evaluation abstract, an implementation plan, and an evaluation plan. Next slide. Phase 2 focuses on implementation. These activities, including obtaining consent and assent forms for parents and participants for the program and the study, implementing the intervention and controller comparison group activities, if that's applicable, conducting fidelity monitoring and supervision activities, conducting participant engagement and retention strategies, conducting retention tracking and follow-up activities, collecting performance measures data, and completing consort diagrams and baseline equivalence tables. Next slide. The third phase focuses on analysis and reporting, packaging, dissemination, and sustainability. Activities include continuation of implementation, if applicable, completing lessons learned template, an analysis plan, and analyzing the outcome evaluation data, submitting and finalizing the impact evaluation report, manualizing and packaging materials, conducting sustainability activities, submitting at least one manuscript to a peer-reviewed journal, and disseminating lessons learned and findings. Next slide. PREIS programs are expected to document your strategy, the services that you provided, and the delivery of your strategy. You're also required to document any changes in the study processes, the environment, or the context that may potentially influence study outcomes. Next slide. The primary purpose of PrEP performance measures is to collect information from all PrEP grantees on how program objectives are being met. Performance measure data are used for program monitoring, improvement, and reporting. Performance measures are not used to measure program effectiveness or impact. Later on during this presentation, the performance measures TA provider will provide more information on the collection of performance measures. Next slide. As a requirement of the PREIS program, all PREIS programs are expected to design and conduct a rigorous evaluation to determine the effectiveness of the approach proposed. One of two study designs are acceptable. A randomized assignment control trial, also known as an RCT, requires random assignment to either the treatment or control group. A high-quality quasi-experimental design, also known as a QED, does not have random assignment, but still requires assignment to a treatment or comparison group. Both designs require a treatment group that is eligible to receive the full intervention and a control or comparison group that will receive an alternate to the intervention or no intervention at all. Next slide. PREIS programs are required to have both primary and secondary research evaluation questions. Primary questions must address the quantitative outcomes listed in the PrEP legislation. These include reductions in sexual activity, condoms or contraceptive use, or teen pregnancy. Primary outcomes related to sexual activities may include, but are not limited to, abstinence, cessation, and decreases in the frequency of sex. Secondary evaluation questions are factors that may have an indirect effect on these sex risk behaviors. Next slide. Programs are expected to collect data at no more than 3 time points. These time points are baseline, short-term follow-up, and long-term follow-up. Programs with pregnancy birth rate outcomes are expected to have more extended short and long-term follow-ups, which may include 12 to 18-month follow-up periods. Next slide. All evaluation activities must have separate leadership for program implementation and evaluation. They also must have an evaluation lead that provides oversight for all evaluation activities. PREIS grantees must also designate specific staff for recruitment, screening and enrollment, retention, tracking, and follow-up. These staff should be responsible for tracking both intervention and control and comparison groups throughout the study. The evaluation must be conducted by an independent third-party evaluator, and at least 20% of the budget should be set aside for evaluation. Next slide. PREIS grantees are also required to recruit a sample close to what is in the approved research design to ensure they have the adequate power to detect impact. Use uniform forms and templates for the submission of evaluation plans. Ensure that all implementation sites understand and agree to their role in the study. Document program implementation and delivery, and continuously monitor attrition through all data collection time points, noting the reasons and number of participants who were not retained. Next slide. Next, I will share a little bit about the roles and responsibilities of the Adolescent Pregnancy Prevention Program Office. The Program Office reviews applications and reports, responds to programmatic and technical aspects of the grant, ensures that the amounts to be awarded to the grantees are consistent with current legislation, and monitors grantee performance. Next slide. Project officers, or POs, are the contact persons for any programmatic changes or updates. On this slide are examples of their duties and when you should contact your PO. For example, regarding program requirements, program modifications, or changes in scope, budget revisions, changes in key staff, program progress reports, site visits, and technical assistance. The PO's main objective is to ensure that the project is in compliance with the terms and conditions and the authorizing legislation. They may discuss the project's development and observe the project during the implementation and provide programmatic, financial, and evaluative guidance and ascertain technical assistance needs. Next slide. Ongoing technical assistance is provided through emails, webinars, conference calls, virtual meetings, site visits, and site monitoring visits. The next slide. Grantee site visits and site monitoring are essential responsibilities of project officers. You may notice in the Notice of Funding Opportunity announcement that PREIS project officers ideally may come or may virtually join you to do a site visit during years 1 or 2 of the PREIS grant. Your project officer will discuss the scheduling of these site visits with you in the future. The objectives of these visits are to ensure compliance with the terms and conditions, discuss the project's development, observe during implementation, and provide guidance and technical assistance. Next slide. Now I'm going to turn it over to a colleague in the Office of Grants Management, Ms. Bridget Shea Westfall. She will provide you with information on the management of your grant.
Thanks, Jessica. Hello, everyone. My name is Bridget Shea Westfall, and I am the Grants Management Officer for the PREIS program. I'm here along with my colleague, Talina Bennett-Reed, who's the Grants Management Specialist assigned to these grants. I'm going to talk about the role of the Grants Management Office. So for your grant, it might be confusing because you might have grants with other federal agencies where the federal project officer does both the fiscal and administrative and programmatic. But in the Administration for Children and Families, we delineate these responsibilities, and the Office of Grants Management is responsible for providing financial oversight and monitoring, as well as technical assistance for fiscal and administrative matters. We also make sure that the grantee is in compliance with all rules, regulations, laws, the funding opportunity announcement under which you are funded, the legislation, and any type of programmatic fiscal or grants monitoring issues. And if for example, you require additional technical assistance or monitoring, then we would be the ones who would be responsible for making sure that you meet those requirements with the programmatic oversight of your federal project officer and the Family and Youth Services Bureau, as well as making sure that you're aware of your responsibilities and roles. We also provide guidance on all of the fiscal requirements related to your grant, including your notice of award, the terms and conditions and reporting, and any post award amendment changes. So any changes that occur after your award has been made, which is the initial award you received in September, that requires prior approval. And then ultimately at the end of your project period, we'll talk about the closeout. Next slide, please. So in the grants office, you might be wondering, what are we responsible for? So for example, if you have any changes to your grant that are after you've already had an approved award, most of those will require our prior approval, and you need to submit those amendments in GrantSolutions. If you don't already have access to GrantSolutions, make sure that you get it. If you're not assigned to your 90 AP grant, you need to make sure that that is the case. And we will probably have additional training on GrantSolutions, but there are on grantsolutions.gov. You should do the tutorials, which are little videos that go through everything that you would need to know. And they have all the modules for post-award amendments for grants. So anything, for example, if you have to change your budget, if you have to carry over grant funds from one year to the next, we don't do prior approvals just automatically for an active project period. You have to actually request the unobligated balance and make sure that it's tied to specific unmet goals and objectives. If there's changes in key personnel, particularly the authorized official or the program contact, which is the PIPD. For example, the primary investigator project director, that requires the federal project officer to approve that that person has the qualifications and the subject matter expertise to be in that role. And for the authorized official, that needs the grants office to make sure that it's signed by the board or other governance agencies. So for example, if you're a tribe or state, it would be at that governor or a tribal chairperson, chief, or council members level. And if you're at a hospital or university, it would be the CFO or the CEO of the organization. One thing to keep in mind is that you cannot have both people be the same contact. So on your SF425, the standard form 424, I'm sorry, not 425, the standard form 424, which is what you applied with for your grant and your notice of award, please make sure that the authorized official is a different person than the program contact or the PIPD. And that is because we want there to be separation for those two distinct roles. One is more of an administrative role and oversight. The other is a subject matter expert and managing the project with the Family and Youth Services Bureau. It's also a conflict of interest for you to be signing or approving your own work or payment request. So that's why those have to be separate. And then we also provide any training and guidance on submitting financial reports and other official correspondence. We're also the keeper of the files. So your official grants file is the electronic file in GrantSolutions. Your fiscal reports are submitted in the payment management systems. All of this information was on your award attachments that are on the notice of award, and it's kind of in fine print. So one thing that I would suggest is you go to the Administration for Children and Families website, www.acf.hhs.gov, and click on grants, and then click on discretionary grants, which are what your grants are. A discretionary grant is competitive, and then click on post-award requirements and reporting. It has everything that you need to know. You need to bookmark that, maybe print it out. It has all of the information that's in the terms and conditions of your notice of award, but it's much more easy to navigate because that font is really small. It also lets you know how to set up your account so that you can access your money with the payment management system. Next slide, please. Oh, Donna's asking for the link. I'll put it in the chat right here. Just typing it in really quick. Okay, so the payment management systems is completely separate from what we do. It's part of our program support center, and it's kind of like the bank of and I see that Meredith also clicked it. Maybe I only typed it to the hosts and panelists, so she copied it. Thank you, Meredith. It's the bank of HHS. That's where you get your money. One thing to note is that Talina and I are separate from this, and that's because it's a separate and distinct role. That's where you'll be submitting your federal cash transaction reports, your federal financial reports, which replaced the SF425, which was the former financial report that you submitted in GrantSolutions as a grant note if you had a prior grant. After 2016, all federal financial reports are submitted in PMS. and you also will submit federal cash transaction reports. You're responsible for that. What I would suggest, and I think that I can put this in the chat, but I'm not sure, is if I'll put it for everyone. So everyone needs to go to pms.psc.hhs.gov. It should work. They might, if not, just Google payment management system services HHS. So you need to go there and download the recipient manual. That we changed the terms about what we call recipients of federal funds from grantees to recipients. So there's a recipient manual on the PMS website. You'll want to make sure that you're familiar with it. Again, bookmark it, download a copy, maybe put it in a binder. And each person is assigned a liaison or accountant and a backup. So there's always two people in case you can't get a hold of one. It's determined by what entity type you are. So that would be a nonprofit, hospital, university, state, or tribe, and then what state you're located. So for example, if you're the University of Maryland, you would look under University Contacts Maryland, and it will tell you the name of the PMS accountant and liaison and the name of the backup person that they contact. Those are the people you contact if you have any questions about accessing PMS. If for some reason you can't get a hold of someone, you can always contact me and Talina. But we're just going to contact our, Talina put in the chat the correct link. Thank you, Talina. We're going to put you back with those individuals. The only time that you would be talking to us about payment management systems is if your grant is restricted for some reason. That might mean that at the time of the award, there were some things that you needed to change to be in compliance with the funding opportunity announcement or our grants policy. Or for example, if you're out of compliance with your grant from a fiscal or programmatic perspective, we can have further enforcement actions or corrective actions. We look at this as an iterative process, and it isn't to be punitive. It's just to safeguard federal funds until you address those things that we need to look at. And this just talks about PMS, but I think it's really important that you all sign up for the training if you haven't already done so. For recipients, they have it frequently on webinars, and also download the manual on the PMS website. Next slide, please. And this is just the link to the PMS website, and Talina already provided you the link. I gave the link for what it used to be back in the day because I've worked here way too long, and I used to be at Grantee before I started working here 17 years ago. Next slide, please. So this is just about the submission of federal financial reports and program progress reports. So I didn't know, Jessica, if you want me to go through this or if you are going to be submitting it.
Yes, you can go through that.
Okay, so next slide, please. So this is just the program progress reports. And again, this is what I was telling you about that's on your notice of award and also on the ACF website under discretionary grants, post-award requirements. So it lets you know when the program progress reports are. You need to submit these program progress reports for the period of performance in GrantSolutions, uploaded as a grant note, okay? So that's separate from the federal financial reports, which we'll talk about on the next slide, please. So the federal financial reports, those are submitted in PMS. They're not the SF425 because that is what we had prior to fiscal year 2016. For any recipients that were awarded grant funds after fiscal year 2016, we submit the federal financial report, which replaced the SF425 in PMS. You also will be submitting the federal cash transaction report. That's a PMS report, not an ACF report. So it's really important that you go on their website and take that training. They're not to be confused with each other. If for some reason you do not submit these reports, unfortunately, PMS doesn't have a lot of patience and they will restrict your funding if you have delinquent reports. The federal project officer and the grants management specialist, they review the federal financial reports and programmatic reports for satisfactory performance. And obviously we're in a pandemic and there might be different factors that come into play, but they're looking at your work plan that was submitted and approved. as well as if you have appropriate internal controls and you're spending down your money. One thing to make sure of is that you're not what's called floating funds. You should be drawing down money from this grant. You might have other federal funds with HHS or the Administration for Children and Families, but it's really important that you only draw funds down from this grant from the Family and Youth Services Bureau. You might even have additional funds in Family and Youth Services Bureau. Really make sure that you're being a great steward of our funds and being, your work should mirror what you have drawn down. So for example, when you're drawing down funds and you're reporting that you have nothing, that you haven't spent any funds or drawn down any funds, but then your programmatic report shows all these activities you completed, it would make us question where those funds were. Likewise, if you've drawn down a lot of funds, but we see that you're behind on all your deliverables, that's kind of a red flag. Again, we're here as partners and we are collaborating to provide these programs to children and youth in the communities so that they make the best choices with regard to their sexual health and well-being. And so, we're just letting you know that from an administrative and fiscal point, we need to make sure that we adhere to those. And a fun fact is that I used to be a Family and Youth Services Bureau grantee for 5 years. And then I actually worked in the Family and Youth Services Bureau on these grant programs in a prior iteration for 4 years. So this is a really dear project to me. So next slide, please. The SF428 program, SF428 report typically does not pertain to this grant. You shouldn't have any real property that you are using for this grant because it's not construction costs are not approvable. However, if there's tangible property that you purchase, you should be reporting on that form. It's annually reported. It's submitted no longer just as a grant note, but actually in the PTMS, which we can have a subsequent training about because it's not until later this year. But PTMS is part of GrantSolutions, and that's how you submit both the SF428 and 429 project forms. One thing that I would like to note is that if you're looking at vehicles, purchasing vehicles, I think it would be in the best interest to also look at leasing or renting vehicles, unless you live somewhere where that's cost prohibitive or it's not available. And the reason why is because at the end of the life cycle of your grant, you would have to return those that property to the government and or use it for a grant at your organization, state, or tribe that's similar in scope to what you're currently doing. So in most cases, we request that you don't purchase vehicles and that you lease or rent instead. The equipment and supplies that exceed $5,000, those are things that, like, for example, you might have things that you use that are of a medical nature that you use in your teen pregnancy prevention or abstinence education programs. And so that's what you should be, reporting. But for most of these grants, you will not be reporting on the SF428. We'll have additional training on this form closer to the mid-year because it's only submitted annually. Next slide, please. So this is about GrantSolutions. Just let you know, Talina and I are not GrantSolutions Help Desk. That's a separate entity. I just want to let you know that you need to go to the GrantSolutions website and register and have a user account. We only allow a limited amount of people to be on the grant. Once you get your account, you should email Talina, including the 90 AP grant number in the subject line and body of your correspondence so that she can, quote, attach you to the grant. But it's your responsibility to take all the training and to look at the tutorials that they have for post-award amendments and reports on that site. If you have any questions about GrantSolutions, you should first address the questions about GrantSolutions from a systems perspective or getting a user account with the help desk. You should contact Grant OGM about any post-award amendments or, for example, getting assigned once you already have a user account, just that we're distinct. It's not the same as the grants office. Next slide, please. So this next slide, and I'm sorry, I'm going to have to go in a few minutes, so I might have to rush through these slides because unfortunately I have to pick up my son from school. Talina also has to pick up her daughter. It's later in the day for us on the East Coast. So these are the changes that require prior approval. And you can see that any change in scope or objective, changes in key personnel or an absence, that would be like a sabbatical, maternity or paternity leave. If someone is out for an extended period of time, any transfer of funds budgeted for participant support, no cost extensions, which extend the project period and budget period, but do not provide extra funds, any rebudgeting over 25% of a cost category or line item, or anything that involves the personnel cost, and any needs for additional funds. Those require prior approval. As always, your grant funds are subject to the availability of funds. And one thing to note is that the Family and Youth Services Bureau can determine to offset your grant award by any unobligated balance for the years 2, 3, 4, 5 of your grant if you're not drawing down your funds. So I just say that to make sure that you're being proper stewards of your grant funds and using your grant appropriately. Sometimes we see large unobligated balances, and that's kind of an indication to the Administration for Children and Families that maybe your community doesn't need this much money, and maybe another grantee that maybe has a wait list, they might need additional funds. So we could decide to offset your grant if you're not using the funds appropriately. Next slide, please. So this just goes through budget modifications, and because I have to go pick up my son, I am just wanted to reiterate how important it is to go through this training video that I've mentioned before, and what are the prior approval for budget modifications and what that means. The other thing is that you can send any questions that you have to me and Talina if we're not able to get through them in today's webinar. Next slide, please. Again, this is a carryover request. We'll have additional training about this, but you should try not to have carryover requests. It's only for unmet goals and objectives of your grant. It's not simply to spend down funds. And so, you know, when you were carrying over funds, it means that it's attached to goals and objectives in your approved work plan for year 1 of your grant that you did not complete. Next slide, please. And again, no cost extensions are something we would not need to talk about until the last year of your grant. We'll have subsequent trainings on this. It's when you have unmet goals and objectives that you need to complete and you do not get any additional funds, but we extend the project period and budget period as long as your grant funds are not tied to 5 years from the appropriation from Congress. So we would just extend the project and budget period. You would get no additional funds. It would be to complete those unmet goals and objectives. That can be from anywhere from 3 months to 1 year. Any second no cost extension, for example, because of the pandemic, would require prior approval from the immediate office of the secretary here at the Administration for Children and Families, and would also require the approval of the Chief Financial Management Officer. The Chief Financial Grants Management Officer is Ben Goldhaber, and he would have to approve that at that level. It would also have to be approved by the FYSB leadership. Next slide, please. We already talked about this. Just a note is that the SF428 no longer exists. It's the FFR. Next slide, please. So this is what I was talking to you about when I mentioned the ACF website. All of these requirements for the policy and regulatory requirements are on that website, and you should bookmark them, familiarize yourself with them, have them on your website, on your desktop. If you're a paper person like me that likes to reference things, you might want to print them out and put them in binders. One thing that I would also suggest that you put on here, because we don't keep archives of past funding opportunity announcements available to the public, is to download a copy of your funding opportunity announcement under which you were funded for this year for PREIS, and make sure you have a copy of that for your reference, as well as save an electronic PDF copy. Next slide, please. These are some helpful websites. One thing to note is that a lot of the forms on the whitehouse.gov are still in transition because of the change in the administration to the Biden-Harris administration. And if you have questions about the forms or GrantSolutions, that you should, talk to me and to Lena about that. Next slide, please. So yeah, so I am so sorry that I have to jump off because I know you probably have a lot of questions. My colleagues in FYSB have been very gracious to make sure that I was able to still present and then meet my family obligations. So I would just suggest, if you need to, I'll put my name in the chat right here so you can see it. You can just email me at bridgetshay@acf.hss.gov or call at 202-401-54542. I know that some people have contacted me and also emailed me and I haven't responded back to you. I'm so sorry. Right now, we only have 2 people on our team besides me. Well, it's me and Talina, one other person. So I promise that I will get back to you. I'm just still waiting through a lot of emails that I got from people that did not get funded. So it's very nice to talk to people that did get funded, because I know you're excited about your project and will do great work. I look really forward to working with you. Like I said, I see ourselves as a partner, and I've been in your shoes before as a recipient, and I want you to be successfully set up. So if you or your organization needs additional one-on-one training or more frequent check-ins, I'm very happy to speak with you. And Jessica, actually my email goes to both Bridget Shea and Bridget Shea Westfall, because I've worked here forever, so it goes to both email addresses, but thank you. So I have to leave, but thank you, and please feel free to send me any questions. Thank you.
Thank you, Bridget. My name is Laura Holsey. I'm with Mathematica, which provides support for ACF, FYSB, and grantees related to performance measures. Today, my colleague Lauren Murphy and I would like to provide a brief introduction to the PMAPS project and the PREP performance measures. My next slide summarizes the PMAPS project, which Mathematica is conducting for ACF. It has 2 key components. The PM in PMAPS stands for performance measures. Under this part of the project, we support PREP grantees and their subrecipients in collecting performance measures data, including providing training and technical assistance on the measures through a series of webinars and guidance documents. We also operate a web-based system for grantees to submit their performance measures data to ACF. Once grantees submit those data, we analyze them and report to ACF, and also provide visualizations of the performance measures to both ACF and grantees through an online dashboard. Finally, we disseminate performance measures findings to broader audiences, such as through conference presentations, fact sheets, and an interactive brief. APS in PMAPS stands for Adulthood Preparation Subjects. Under this part of the project, we have developed resources to assist PREP grantees in understanding and implementing APS content in their programs. These resources include a report that presents a conceptual model for each APS and a unified framework that identifies commonalities and overlap across the models. Combined, the conceptual models and unified frameworks are intended to help PREP grantees understand how the addition of APS content can improve outcomes for participating youth, develop APS-related content, and target specific outcomes in your programs. Complementing the report are 3 briefs. 1 discusses strategies for addressing financial literacy within PREP, including the importance of delivering content that's timely, sequential, relevant, and developmentally appropriate. A second brief provides guidance on using the APS conceptual models to tailor PREP programming to pregnant and parenting youth. And a final brief describes the value of a positive youth development approach in relation to APS and how to integrate positive youth development into PREP programming. Turning now to the performance measures, as shown on my next slide, they serve several related purposes. Performance measures help ACF monitor program implementation, including whether PREP objectives and legislative requirements are being met. performance measures can create a foundation for program improvement efforts by ensuring that grantees have data they can use to assess their own and their subrecipients' performance and progress over time, and identify training and technical assistance needs. Finally, performance measures facilitate reporting information about PREP to policymakers and legislators. The graphic on my next slide shows that the PREP performance measures originate from multiple levels. Each grantee reports data to ACF, including information at the grantee level and also from providers, program models, and participants. To cover some terminology we use for performance measures, providers in this context are the organizations working directly with youth. Some providers are subrecipients, but other grantees act as providers operating programs directly. Programs here refers to the curriculum model being implemented, and participants refer to the youth served, who provide data by completing entry and exit surveys, which are aggregated to the program level for reporting to ACF. And now I'll turn the presentation over to my colleague Lauren Murphy, who will provide more information on the performance measures themselves.
Great, thank you, Laura. So I'm happy to share an introduction to the PREP performance measures. You'll learn more detail about these measures at upcoming webinars, and those dates will be listed in a few slides. So PREP performance measures fall into three broad categories, and the frequency of submission and the reporting periods vary by category. So the first set of measures are structure, cost, and support for program implementation, and those are submitted once a year, and the period covered is a full federal grant year, so October through September. The other measures of attendance, reach, and dosage, and participant characteristics, program experiences, and perceptions of program effects are submitted twice a year, with each round covering the previous 6 months of programming. For instance, in the summer, you would submit data covering January through June. On the next slide, we'll look at the first category of structure, cost, and support. These measures are reported at the grantee, provider, and program level. The first set of measures describe how your grant is structured. You'll report on grantee and provider staffing. You'll also describe what programming is provided to youth, such as the program model implemented, the APS selected and how they are implemented, and intended delivery hours. You'll also report on your target populations. Measures of cost include reporting on both PREP grant funding and allocation, as well as provider level funding. Lastly, in this category are measures of support for implementation. This includes reporting on how training, technical assistance, and observations are provided, and the implementation challenges providers face and their technical assistance needs. On the next slide is the category of measures of attendance, reach, and dosage. These measures are collected at the participant level, but are aggregated to the program level. Performance measures from attendance include the number of youth who attended at least one session overall, as well as by grade grouping and by setting. The measure of program reach is based on whether at least 50% of youth served by each program model were from a specific population. Some examples include youth in foster care or youth in the juvenile justice system. Then there are measures of program dosage, such as the number of youth who complete at least 75% of the intended program hours, the number of program hours delivered to each cohort, and the number of completed cohorts overall for the reporting period. On the next slide is the last category, measures of participant characteristics, program experiences, and perceptions of program effects. And these measures are the measures that are collected through the participant entry and exit surveys, and they are reported at an aggregate level at the program model level. Entry survey items include participant characteristics or demographics such as age and race, and the same set of measures are reported on the exit survey. The exit survey also asks youth about their experiences in the program and their perceptions of the effects of PrEP program on their sexual risk behaviors. So that covers the introduction to the measures, but on the next slide are some additional resources. I'd like you to point you to the PMAPS website, prepeval.com, and I'll add that to the chat in a moment. Now, sorry, just make sure I'm clicking on the everyone. There we go. So here you'll find some information on the APS reports and briefs, as well as the performance measures themselves. I will note that there are revisions currently under review at OMB to the performance measures, and they are expected to be available shortly. The materials that are posted on the website are from previous rounds of data collection, but the revisions to the measures are minor. So the materials that are currently available are still a useful resource for any preparation work that you might have for partners or IRBs. Next slide. Lastly, we have a set of training webinars that will discuss the measures further and provide guidance on working with partners or institutional review boards, as well as survey administration. The updated measures will be available during these webinars. You can also expect to receive webinar invitations coming from our project help desk, Prep Performance Measures at mathematica-mpr.com, and those invitations will be coming out shortly. So you can expect dates for November and early December webinar. That covers the performance measures. I'm now happy to pass the presentation over to Kathleen McCoy from OPRE.
Thanks, Lauren. My name is Kathleen McCoy, and I'm from the Office of Planning, Research, and Evaluation. Myself and Selma Cowell, we oversee the local evaluation support that we'll talk about today. Next slide, please. So some general background on who the Office for Planning, Research, and Evaluation is. Our office, it builds and disseminates knowledge about effective approaches to helping low-income children and families through rigorous research and evaluation projects, such as evaluations of existing programs and innovative approaches to help low-income children and families, which is what PREIS falls into, research syntheses, and descriptive and exploratory studies. Next slide. So in terms of the structure of the local evaluation support that we'll be providing to PREIS grantees, it falls into this main overarching structure. So you have at the top, you have ACF. From ACF, you have two offices that you'll be working with, the FYSB and the Office for Planning, Research, and Evaluation, also known as OPRE. FYSB, their primary job is to oversee the grants. So within FYSB, you have the project officers, then you have the PREIS grantees, and then you have the local evaluators. On the right-hand side, you have OPRE. Our job is to oversee the local evaluation contract, which we refer to as PLEASed. The contractor who has been awarded the PLEASed contract is Apt Associates. Their job, and our job, I should say, is to provide a consulting relationship between FYSB and the grantees and the Office for Planning, Research, and Evaluation and APT. APT is ultimately going to be providing some local evaluation liaisons to provide this consulting relationships to help oversee this local evaluation support to help all of the grantees conduct rigorous evaluations. Next slide. In terms of the local evaluation goals and objectives, the goal is to support grantees in conducting high quality and rigorous impact program evaluations. And the main objective is to provide local evaluation support that will help guide and facilitate grantees through the planning, implementation, data analysis, and reporting of the grantees' evaluations. The main goal of this local evaluation support is to help provide support to the grantees from start to finish. So starting with the evaluation design all the way through doing the data analyses and the final reporting. Next slide. Some example local evaluation activities that will be conducted fall into three primary buckets. First is to provide grantee-specific support. What this will look like is, for instance, providing grantees with templates to be completed, such as templates for developing evaluation plans, developing data analysis plans, and developing the final report. Secondly, another main component of this grantee-specific support is to provide document review and individual conference calls. So for each of you PREIS grantees, you'll be provided a local evaluation liaison, which you will work with, again, from start to finish, from the evaluation design planning phase all the way through the end. And you get individual T and TA through various mechanisms such as conference calls. The second main bucket of LES activities is group-based local evaluation support. What would that look like is offering webinars to the PREIS grantees as a whole, office hours, and trainings on how to actually complete the templates that you're going to get in that grantee-specific support. And the third primary bucket of example local evaluation activities is to provide training resources to grantees, such as developing toolkits, guides, manuals, handouts, a project website, various resources that hopefully can help facilitate your local evaluations that you will be conducted. Next slide, please. So the local evaluation support, it falls into three main primary phases, which you've already heard about, the three main phases of your grants. In phase one, the primary evaluation activity that's going to be conducted is actually helping you grantees design your evaluations. In your grantee applications, you've already laid out what your evaluation is going to look like. In this evaluation design phase, you're going to hone in and really get more specific to make sure that it's a strong, rigorous evaluation plan. Some key components of this plan that you'll be having to do with identifying the program model, identifying the specific research questions that you hope to achieve in your research design. What are your specific target populations? What is the anticipated of you hope to be able to serve? How are you going to What are your data collection procedures? So for instance, how are you going to get consent or assent from parents and youth? How are you going to get youth to fill out the baseline surveys? How are you going to follow up with the youth in terms of getting short-term and long-term follow-up, et cetera? And then lastly, what are your specific outcomes that you hope to measure and achieve and invoke changes on? And so all of this is going to be completed as part of your research design plan to, again, really make sure you have a strong structure in place when you actually get into the field conducting your local evaluations. Next slide. So moving on to phase two. Phase two is when you all are going to be actually implementing your program and conducting your evaluation. So phase one is when you're designing. Phase two is when you're in the field and actually doing the implementation. Some example evaluation activities that will be conducted are having these regular meetings with your LES point of contact. Also, ensuring that data is being collected in a rigorous fashion according to the evaluation plan. So going back to the activities you did in phase one, continuing to return to that, seeing how things are going and making sure that you're conducting a rigorous evaluation according to plan to ultimately get to the outcomes that you. Next slide. And then lastly, in phase three, this is when you're going to be developing your data analysis plan, actually conducting your data analyses and writing up your final report. So after you're done with program implementation, that's when you're going to be actually getting into analyzing your data and seeing if you had impacts, which is a really, really exciting time. So during this phase, you'll be outlining how your primary and secondary research questions are actually going to be analyzed. Then you'll be conducting your data analysis plan according to what was laid out in that analysis plan. And then lastly, you'll get to write up the final report and summarize what the findings are, which is a really, really exciting stage. Next slide. And so then here's some general contact information for OPRE. And with that, I will go ahead and pass it on to Meredith Cruz, who will take over for RTI.
Good afternoon, everyone. I'm Meredith Cruz. I'm a project manager at RTI International, and I'll be sharing a little bit today about the training and technical assistance that we will provide to you. On the next slide, you'll see the logos of our own organization and of our partners, Child Trends, ETR, and MEES. We will serve as a resource for your programs, and we'd like to again congratulate you on your awards. On the next slide, you'll see some topics that we've listed to help you understand what TA is meant to be. We provide customized assistance to support and strengthen your program, and that can range from helping you define a problem, address an already identified problem, developing a new solution, or to try new things. Our TA providers have experience in program planning, implementation and management, staff recruitment and retention, virtual implementation, and evidence-based and informed practices, and sustainability and many other areas that will be helpful to you as you implement your program. We'll take the time to get to know you and your program so that we can work together to find the best method to address your needs. We provide complimentary services in a variety of formats that you'll see on the next slide. At no cost to your program, we provide webinars, tip sheets, hold office hours, host an annual conference, and we have a website called The Exchange dedicated to resources to supporting your programming. So how do you access our services? On the next slide, you'll see that there are many opportunities to participate in small group TA. You'll receive regular e-blasts for participation in small group events like office hours, webinars, and cluster calls. Also on this slide, you'll see that there are a couple of safe senders that we'd like you to add to your organization's safe sender list to make sure you're receiving those emails. If you're not receiving at least one email a month, I'd recommend that you reach out to us, and we'll put the email address in the chat. You are also able to reach out directly to your project officer to request one-on-one TA, and you may be contacted directly regarding proactive TA opportunities. On the next slide, we'll discuss what happens next after you ask for a one-on-one TA request. Once we've been assigned a request, we'll reach out to you to set up an appointment and discuss your needs. The TA provider will then develop a plan with you, and will keep your project officer informed of the progress and may check in with you regularly until the needs are met. And then once the request is addressed, we'll close the request, and you may receive a satisfaction survey on the TA to let us know how we did, and we're glad to have your feedback. On the next slide, you'll see that there are a couple opportunities throughout each year for you to participate in topical trainings and an annual conference. There are 2 topical trainings that will be planned during this fiscal year, and 2 staff are required to attend at least 1 training. The topics will be announced soon, so look out for those. And then we are also planning on the conference to occur at the end of June 2022 in Atlanta, Georgia. We're hopeful to be in person, but that is still to be determined at this time, and we will keep you posted on that. There are a lot of benefits associated with these events, including being able to connect with other grantees and have face-to-face time with your project officers, and to learn about new FYSB opportunities and increase your skills. The next couple of slides show you the Exchange website, and I'll type that link into the chat. This website is a location where you can access a lot of resources that are available to you that have been developed over the last several years. And it's where we'll post things like the recording from this webinar and other webinars that you might see coming out over the next year. On the next slide, you'll see where you can navigate on the website to the resource tab to see relevant resources, and you can filter by different topic areas or content type. On the next slide, you'll see how you can navigate to the events calendar, which should have things on it such as these webinars that you'll see here. You'll also see cluster calls and other opportunities for you to participate in. And finally, on the next slide, you'll see an opportunity to connect with other grantees. We have a comment wall where you can come and pose questions to other grantees and ask to connect with them and share and learn together. And I believe that's the last slide. Again, on the next slide is our contact information. I'll also drop that email address in the chat. You can reach out at any time if you have questions, and we are happy to support you. I am going to hand it off to my colleague, Katie Swellentrop, to cover the We Think Twice campaign.
Awesome. Thanks so much, Meredith. And I know we're getting towards the end of a 90-minute session, so everyone's probably getting a little bit tired, but I'm going to tell you about one more thing that we have to offer, and then turn it back over to FYSB or to Jessica to take us through some Q&A if we have any time. I'm really excited to be talking to you today about We Think Twice. We're going to start out by telling you a little bit about what it is and sharing some information about what we've developed so far and some plans we have for the future. Go ahead to the next slide, please. So one of the best parts about the We Think Twice campaign is that youth are really involved in all aspects of this campaign. We started by developing or collaborating with young people to help us determine what we should develop, how it should look, what the focus should be. And it's really been designed and informed by young people throughout the time that we've had it. The goals of the campaign are to shift perceptions and social norms to help youth resist negative peer pressure. And we're also helping them build knowledge and skills for things like forming healthy relationships, setting goals for the future, and empowering them to make healthy decisions. We really see it as a strategy and a website and a digital campaign that can help support the goals of the APP program and you, the grantees. If you go to the next slide, gives you an overview of what the campaign looks like. So we have multiple prongs. Our kind of base or the central node is our website, which you can access at wethinktwice.org. We also have multiple digital products for young people on the website that you can download or send to them. We have an insider page where we engage youth, as I mentioned, over time. So I can send you the link to that later, but youth join this page. We're having constantly new members and they provide us feedback on ongoing social media content and digital products. We also have some tools for youth serving professionals. Those are most likely going to be accessed through the exchange. We have an Instagram account and we have a Facebook account as well. You can go to the next slide. And you can tell from this that we've had so far over 13 million impressions on our posts. We have very high organic engagement with the young people that we reach. I think we've done about 400 posts so far. We also launched our website last year, and so far we've had over 100,000 users and over 140,000 page views. And I will say that if you take a look at our products, we have a lot of like quizzes and listicles and other things that are fun, and they might help you think about some of the APS resource product or APS resource topics like financial literacy. We have a financial literacy quiz. So there's some cool tools that you can think about incorporating in your own program. I did want to say that we also received a first place award of excellence in the 2021 website category for the Blue Pencil and Gold Screen Award, which was offered by the National Association of Government Communicators. And we're really excited about all the tools that we've developed so far. And you can keep checking back at wethinktwice.org for more tools to help support your programming going forward. Go to the next slide. This is just some examples of our top Instagram content and our top website pages. We continue to see a lot of interest in healthy relationship content. And you'll see by this top Instagram content, which was a virtual hug, there's a lot of interest in sharing good news online and how can we empower young people with the tools and resources to share tools and techniques with each other and just send good news around to each other. If you go to the next slide, please. So as I mentioned, a way for your youth to get involved, they can follow us on Instagram, and we encourage you to send out our Instagram handle to any of you that you're involved with, and they can also visit our website. We will be sending out e-blasts with more information about updated tools and that sort of thing. I think we send a We Think Twice e-blast about once a month. So you can stay up to date on the most recent information that we have on our campaign. And if you go to the next slide. They can also, as I mentioned, join our We Think Twice Insiders, where they can earn points towards gift cards and help shape the campaign. We're also always doing design labs or focus groups virtually mostly now, but you can always email us at apptta@rti.org if you have a group of young people who would like to participate in one of these design labs. And with that, I believe I'm going to turn it over to Labrita White to talk a little bit more.
Thank you so much, Katie. And good afternoon, PREIS grantees. And again, congratulations on your 2021 Cooperative Agreement Awards. I know it's been a long afternoon, but just want to share that you are part of the third cohort of PREIS federal grant recipients, and we are certainly looking forward to a successful partnership with you over the next 5 years. I know you have received a significant amount of information again this afternoon, so I will certainly be brief with my remarks. I first want to thank our federal staff and contractors for presenting very much essential information during today's webinar, and would reiterate that they stand ready to provide you with the necessary support and assistance as you implement your PREIS projects. The next several months are certainly critical to your success, and we will be working with you to plan and pilot your projects in preparation for full implementation of quality services targeted to some of the most vulnerable youth across the nation. So just as critical, and what makes the PREIS program unique among many other APP programs, is the rigorous evaluation requirement. Your projects will yield results to inform the field, and your innovations to abstinence and contraceptive education will definitely influence future programming. And so you all are, in essence, some trailblazers for the field as you're implementing these innovative projects. And so we're looking forward to the outcome, as well as the results and impacts that will be presented at the end of your projects. We know there will likely be challenges along the way. However, we know that when we're open and transparent with our communication, through your innovation, your creativity, and all of us working cooperatively, there is definitely going to be inevitable success and accomplishments of goals of the PREIS project. This accomplishment or success is also contingent upon your partners, your contractors, and subrecipients. So I encourage you to invite your partners to participate in all relevant training, technical assistance sessions that will be offered throughout the next, through this year and the next several years. There'll be training and technical assistance on programming, data collection, as well as evaluation. We know that your efforts could not be successful without your partners, your contractors. And so again, making certain that everyone has the same information and operating with the same information, again, is definitely needful. So you're further encouraged to review the recording of today's webinar, as well as to share the recording with all staff affiliated with your project, and to refer to your grantee guidance document for information on the management of your grant. The guidance document was shared with you by your assigned federal project officer in their introductory email. Again, that document provides some very helpful information, some of which information that was shared today is summarized there. And so it's a great go-to resource. And so with this slide, and before we move on to questions and answers, here's a list of the most popular and frequently used websites by grantees. A plethora of information is located on each site to provide you with guidance on grant-related activities. And so definitely please take advantage and utilize those resources. Again, I say congrats. Thanks for your participation in today's webinar. And let's move on to question and answers, to the question and answer session. At this time, Meredith Cruz with RTI will moderate any questions that are submitted in the chat or the Q&A box. So feel free to insert those questions now, and we will respond verbally or in writing. Any questions, Meredith?
There aren't any new ones. I'll just read out in case anyone missed them that there were a couple questions about the timing of the medical accuracy reviews. And I believe the kind of answer to that is that the project officers will follow up about the timing. I don't know if there's anything else you want to share on that one.
I would say that the timing is also going to be contingent upon where PREIS grantees are in their planning, because your project's a little different than some of our other APP programs. But we will be sharing in a webinar, I think Jessica may have alluded to when she shared about medical accuracy reviews. We will provide all grantees with a webinar training session the early part of November on the medical accuracy review process and how to submit required documentation. Anything you want to add to that, Jessica?
Nothing else. Thank you, Loretta.
Sure.
And the only other question we got was about when the slides from this session would be shared. And we will be sending a copy of the slides after the session, and ultimately they'll be posted on the Exchange website, which we had shared on the previous slide and in the chat. So I don't see any other questions. We can give it a moment and see if anyone else has questions. All right. Well, thank you all again for your participation today. We look forward to working with you. I know the FYSB team is really excited to have you on. I'll pass it to Jessica for any last words.
All right, no last words. Thank you so much. I'm sure that you're overwhelmed, but as Loretta mentioned, a lot of this is in your grant administration guidance document. And if you haven't already met with your project officer, we're here for you as resources, as guidance. Sometimes we might be your counselors to help you through as well. So we thank you and we hope you have a great afternoon.